Hi, and welcome to our channel. In today's video we will be talking about fractures, its classification, process of healing of fractures, principles of its management and various complications which can occur in fractures. But before we begin, if you are new to our channel, then please click on the subscribe button and press the bell icon so that you remain updated with our new videos. So first of all, let's begin with what is a fracture. Well, a fracture can be defined as a break in the continuity of a bone. Mostly it occurs due to direct or indirect trauma to the bone. Sometimes it can also occur in a diseased bone following a minor trauma, in which case it is called as a pathological fracture. A fracture can be simple, which is also known as closed fracture, or it can be compound, which is also known as open fracture. In a simple fracture, there is no wound directly over the fracture, and so it does not communicate with the exterior. But in a compound fracture, the fracture communicates with the exterior through a wound over the fracture. Their management may pose problems of skin and soft tissue loss and infections. Fractures can be described into following types. Transverse fracture. In this, the fracture is transversely placed and is caused by direct injury to the bone. Oblique fracture. In this, the fracture line is obliquely placed and is caused due to an indirect injury. Spiral fracture results from rotational or twisting force to the bone. Comminuted fracture is a fracture where the fractured bone is broken into more than two pieces. Segmental fracture is also known as double fracture and occurs at two different levels. An avulsed fracture is an injury to the bone in a location where a tendon or ligament attaches to the bone. When an avulsion fracture occurs, the tendon or ligament pulls off a piece of the bone. An impacted is a fracture in which the fractured bone ends are driven into each other. Taurus fracture, which is also known as a buckle fracture, is the most common fracture in children. It is a common occurrence following a fall, as the wrist absorbs most of the impact and compresses the bony cortex on one side and remains intact on the other, creating a bulging effect. Green stick fracture is a type of incomplete fracture seen in children in which one or both cortices of a bone are broken but there is no discontinuity. Compression fracture occurs as a result of compressive forces on the bone due to which the bony mass gets compressed within itself, commonly seen in vertebral body. Healing of fractured bone occurs in three phases: inflammatory phase, cellular proliferation phase, and remodeling phase. In inflammatory phase, a clot is formed between and around the broken bone ends, followed by vasodilation, release of protein and blood cells in this area. In cellular proliferation phase, the bone ends become rarefied and calcium is laid down on the granulation tissue as callus. At this stage, the fracture is said to be united clinically but is not strong enough to be exposed to stress. In remodeling phase, the soft callus gets hardened by the deposition of bone salts carried out by the osteoblasts. The bone tissue always heals by forming a new bone which has all the characteristics of the normal bone. New techniques of treatment are added every now and then, but the basic principles are: to achieve anatomical alignment, to assure correct immobilization, to improve circulation, and to reduce inflammation and pain. Basic methods of treatment are reduction, immobilization, and protection. Reduction can be closed where alignment is achieved by manipulation, or open where alignment is achieved by surgical operation. Immobilization is important for maintaining alignment of the reduced fracture and can be achieved by traction, POP cast, functional cast brace, internal fixation or external fixation. Various complications which can arise following fractures are injury to blood vessels, bone infection, Taurus reticular adhesions between long muscle, ligaments, joint capsule and bone. Intra-articular adhesions, malunion, non-union and delayed union. Myositis or ectopic ossification. Sudex osteodystrophy, nerve injuries and pressure sores. If you have liked this video, please don't forget to like and share this video. You can also follow us on Instagram and Facebook.